Hello and welcome to Gulf Coast VA Today, an informational show about what's happening in the Gulf Coast Veterans Healthcare System. Each month, we cover news, services, and programs in our healthcare system relevant to you, the veteran. I'm your host, Vernon Stewart, Chief of Community and Public Affairs and Marine Corps veteran. Today, I have with us our lead suicide prevention coordinator, Dawn-Mucha Johnson. Now, Dawn, before we get into your program, tell us a little bit about yourself.
I am the lead suicide prevention coordinator, but I also have a great family connection to the service, as in all of my nephews have recently joined. And so I have one in the Army, one in the Navy, and one in the Air Force now as of last Thursday. So that is my personal connection. I have worked in mental health for 15 years. Prior to coming to the VA, I worked with children and adolescents for the most of my career, focused a lot on suicide prevention, substance abuse, trauma, and then made a segue into the VA about 7 months ago. And my goal is to continue to stay here so that I can help serve all of those who served us without knowing that they were there.
So suicide prevention is our top clinical priority across the VA. It's very important. Tell us what exactly is suicide prevention.
Suicide prevention is a program that the VA has to ensure that all of the veterans who are at an acute risk for suicide are engaged in care and getting the services that they need. We may answer veteran crisis line calls and respond to those, and then have the veteran connected to the resources that they need, whether it be mental health, physical health, or community care.
Great. So this is, as we said, a very important aspect as it relates to veterans. We know many veterans suffer in silence each and every day. So this is one thing that we definitely want to get the word out about, and how we in the community can help serve those veterans that may be struggling. So tell us a little bit about what your team does and what a typical day in your program looks like.
Our team works a lot with the community to make sure that we give out the SAVE training. So we present a SAVE training, which helps community gatekeepers recognize signs and symptoms of suicidality, of depression, and then teach them to verbalize and encourage treatment so that they can help prevent suicide as well. A typical day is a lot of responding to the crisis calls that come in overnight, and making sure that we connect each one of those veterans with the services that they need. We may reach out to them, their family, do another assessment to see where their suicide risk is at the moment, help them create a safety plan, and connect them to not only the VA, but the veterans need their community and their families to all be around them so that we can help prevent suicide. We do a lot of mailers. We mail out care and communications at least once a month that go to all the veterans to let them know that we are still there. We have a program for high-risk veterans. So those high-risk veterans have a flag on their chart, which is there to help encourage more treatment and to help embrace them to make sure they get the treatment that they need. They will have an increase in phone calls, so we will contact our veterans once a week for 4 weeks, and then once a month after that to make sure that they are safe and they are okay and getting the care that they need. The flag is an enhancement to treatment, not a hindrance. It is something there to help and protect.
Right, absolutely. And I know we offer a lot of training and services for those veterans and their family members. But for those family members, supporters, and even veterans that are watching right now, what are some things that you can specifically say that they need to be on the lookout for if them or their loved one may be struggling?
Some of the main symptoms are depression, sadness, withdrawal, an increase in risky behaviors, whether that be overeating, over drinking, any type of behavior that can be taken to an extreme, or if there's that isolation that pulls them back out of the community. So doing that and then asking them, as hard as it is, ask them and have the conversation of, are you thinking of killing yourself? Because that's the real heart of it, is to see whether or not they are suicidal. Validate their feelings and tell them, I hear you and I understand you and I'm listening to hear, not listening to answer. And then moving from there and getting them treatment. So making sure that we look for those signs and symptoms. The depression sometimes gets overlooked because not everyone is sad when they're depressed. There are people who are irritable and angry and frustrated, and those people may be suffering from, suicidality as well.
Yeah, absolutely. And so when the family members or the veterans, when they recognize and see these signs, as you so eloquently put, these signs to look out for, we have set up, and the VA across the country has set up the Veterans Crisis Line. So why don't you tell us a little bit about that and the number for it?
The Veterans Crisis Line is a national hotline. It is for veterans, but it is also for everyone in the United States or anywhere. So to get specifically to the veterans, you would dial 1-800-273-8255 and then press 1. That prompt for 1 is going to get you to the Veterans Crisis Line. It is a call center, and then they field the calls. So if the veteran is at risk at that moment, if they are suicidal at that moment, they will initiate a rescue, and we'll be able to get that help to them quickly. They will take that down, and then they will refer it to us. The Veterans Crisis Line also helps connect with resources as well. If a veteran is out and they're homeless and they need some resources, the Veterans Crisis Line can help connect them to shelters and food and education and employment. Those kind of resources are available out there. They will send the referral to the local area. So no matter where you live or what VA is your primary care, they will send that referral to wherever you need it to go.
Yeah, and I just want to circle back to one other thing that you mentioned. The hardest thing about seeing a loved one or a veteran struggling is, as you mentioned, is you have to ask that question. And I know that there's a big campaign going on right now, #BeThere. So simply being there for that veteran, that loved one, is sometimes enough, but sometimes it may not be. So what are some other items that people can do? The folks that are watching, veterans, family, their friends, what can they do to help this pandemic in preventing suicide?
I think with the pandemic, it has shifted all of us out of that personal contact of seeing each other daily and being able to pat on the shoulder and say, hey, are you okay? So there is a lot of video calls, and so increasing that, making more contact with them, checking and seeing if they're going out. And, if everyone's on video, make sure they got up and got dressed, not just put on a shirt so they look like they're doing something, but they got up, they took care of their hygiene, they did things like that. Having more connection is better. If you are really concerned about your veteran or your family, connecting with them more often and making time to listen. A lot of times we just call and we're like, hey, how are you doing? And so often when we walk past someone and we're like, hey, how are you today? Our response is, fine, how are you? When neither one may be fine. So listening to those nonverbal cues and checking on those. I like the idea of the increased technology and the increased communication through technology, because you can see people that are far away, but it's making sure that we're using it and we're using it appropriately to make sure and check in. So make sure you're looking at them and seeing them. Have them walk around the house. Say, oh, well, let's go see what's going on over there. So you can see, how is the house going? How are those other things in their world going? Are their plants okay? Are their pets okay? Check those surroundings and be aware of all the small little things that might play into it.
Very good point. And Dawn, what's that phone number again to the Veterans Crisis Line?
The phone number to the Veterans Crisis Line is 1-800-273-8255 and press 1 to get the veterans.
Awesome. Well, again, Dawn, I want to thank you for joining us today to talk about your service in the very important topic of suicide prevention among veterans, their family, and friends. Thank you so much for joining us. You have a good one.
You as well. Thanks for having me.
And thank you for joining us on Gulf Coast VA Today. Make sure to follow us on Facebook and Instagram at VA Gulf Coast and visit our website at www.biloxi.va.gov, where you can subscribe to our email list so you are always in the know. Be sure to also tune in for our next episode. Until then, soldiers, sailors, airmen, Coast Guardsmen, Marines, family and friends, thank you for your service and your support. Semper Fidelis.